Hello everyone, my name is Austin Smith, and today I will be presenting my proposed evidence-based practice intervention titled Cognitive Behavioral Therapy for Adults with Schizophrenia. So the purpose of this presentation is to discuss the significance of schizophrenia as a healthcare problem, review the supporting evidence for cognitive behavioral therapy, explain the theoretical framework guiding this project, and outline an implementation plan. So a little bit of a background, schizophrenia is a chronic and severe psychiatric disorder that affects approximately 1% of the population worldwide. Individuals living with schizophrenia experience disturbances in thinking, perception, emotions, and behavior. Common symptoms include hallucinations, delusions, disorganized thinking, social withdrawal, and cognitive impairment. Although antipsychotic medication remains the cornerstone of treatment, many patients continue to experience persistent positive symptoms, negative symptoms, and impaired functioning despite medication adherence. And these symptoms contribute to different things like frequent hospitalizations, poor quality of life, and just impaired social functioning. Because medication alone does not fully address these challenges, evidence supports incorporating psychosocial interventions such as cognitive behavioral therapy to improve overall mental health outcomes. Therefore, my PICO question that I have come up with is, in adults with schizophrenia, how does cognitive behavioral therapy compared to standard care affect overall mental state within a 3-month period? So for a theoretical framework, the one that guides this project is Peplaw's theory of interpersonal relations. Peplaw believed that the therapeutic nurse-patient relationship is central to improving mental health outcomes, which it was broken down into 4 phases: orientation, identification, exploitation, and resolution. So CBT aligns very well with this theory because successful CBT depends on trust, collaboration, communication, and patient engagement. So some evidence that supports the use of CBT. Right now, current literature consistently supports the use of CBT as an adjunct to pharmacologic care. The first study that I found was a randomized controlled trial demonstrating that CBT significantly reduced positive psychotic symptoms and improved overall functioning compared to standard care. Second study I found that patients receiving CBT experienced improvements in their symptom management, coping skills, and quality of life. And then a third study, which was a qualitative study, explored different patient experiences with CBT. And many of them reported that the therapy helped them better understand their hallucinations and delusions, reduce distress associated with the symptoms, and improve their overall confidence. So lastly, I've come up with a plan to implement. To begin, it begins with patient identification. So eligible patients would include adults diagnosed with schizophrenia who continue experiencing persistent symptoms despite receiving antipsychotic medications. Screening would occur during psychiatric evaluations using standardized assessment tools such as the Positive and Negative Syndrome Scale, or the PANS, and the Brief Psychiatric Rating Scale, or the BPRS. So patients would be evaluated for their ability to participate in these therapy sessions. For the intervention itself, patients would participate in an 8 to 12 week cognitive behavioral therapy program consisting of weekly individual sessions. These sessions would focus on different things like identifying maladaptive thoughts, challenging cognitive distortions, reality testing, developing coping skills, and relapse prevention. The intervention would be delivered by trained psychiatric providers experienced in CBT, and family education is also a very important thing to be incorporated. So with the outcomes and evaluation, patient outcomes would be measured before and after completion of the intervention. These measures would include their change in their PANS score, symptom severity, their overall mental state, their participation, treatment adherence, and their overall satisfaction. Additional outcomes would include reductions in psychiatric hospitalizations and improvements in their daily functioning. Collecting these measures will determine whether CBT improves overall mental state compared to standard care. So for the timeline, the proposed implementation plan spans approximately fully across 6 months. Month one would include things such as stakeholder approval, staff education, and development of CBT protocols. And then months 2 through 3 would be where you actually recruit patients, complete the screening, and implement the weekly CBT sessions. And then the last couple months would be collecting the data, evaluating the results, and then identifying opportunities for improvement. Following a successful implementation, the intervention could become part of routine behavioral health practice. In conclusion, schizophrenia remains a complex psychiatric disorder that significantly impacts patients, families, and healthcare systems. Evidence demonstrates that cognitive behavioral therapy is an effective adjunctive treatment that improves symptom management, coping abilities, and overall mental state when combined with standard pharmacologic care. Using Peplaw's theory of interpersonal relations is a great way to provide a strong framework for implementing this intervention into clinical practice. As a future psychiatric mental health nurse practitioner, integrating evidence-based psychosocial interventions such as CBT has the potential to improve many patient outcomes and their quality of life. And thank you for your time.